Here we go.
Are we live?
Yes, sir.
Good morning. Recognizing quorum, I'm calling this meeting of the Cannabis Control Commission to order at 9 a.m. on April 3rd, 2020. This meeting is being recorded. I want to start by offering my gratitude and admiration for all of the heroes who are on the front lines helping to keep us safe. Doctors, nurses, EMTs, other medical professionals, first responders, all others. Please be careful, be safe. Secondly, my thanks to the Governor, Attorney General, and Legislature for temporarily relaxing some of the open meeting law requirements to allow us to meet and do our necessary business remotely and safely. I'd also like to thank our Chief of Staff, Erica Schiavelli, and our Chief Technology Officer, Dave McKenna, for configuring and operating the technology that allows us to do this meeting remotely. My apologies in advance if my remote meeting management skills prove to be not up to snuff. Since the beginning of this crisis, the Commission's focus has been on the safety and well-being of the industry's customers, patients, and agents, and that of our staff as well. We have issued directives to assist the industry in complying with the Governor's executive order that temporarily shut down the adult use industry while ensuring the maintenance of essential security protocols. That same order deemed the medical marijuana industry as essential. We have taken a number of steps, which will be detailed in this meeting, to ensure that medical cultivation, manufacturing, and dispensaries operate in a manner that provides the greatest possible amount of safety for patients, agents, and the general public. I want to thank Sean and all of the staff who have been working tirelessly in collaboration with the industry in offering guidance and directives, as well as taking appropriate and necessary administrative actions to accomplish this objective. We closed our offices 3 weeks ago, and thanks to the technology investments made under the leadership of Sean and our CTO, the aforementioned Dave McKenna, when we relocated our offices, we have been able to continue operations remotely, processing patient certifications, license applications, renewals, and changes of control, while continuing to ensure regulatory compliance on the part of our licensees. As you will see at our regularly scheduled public meeting next week, if anything, our productivity has increased. Again, my thanks to Sean and the staff. Erica, if you would put up the agenda, please. There are 2 agenda items for today's meeting. First, I've asked Sean to review the list of actions taken by the Commission in response to the COVID-19 crisis. The objectives of doing so are to ensure that we all, the 5 commissioners, the public, are up to speed and on the same page with respect to how we're working to meet patient needs by keeping the industry operational and safe. And secondly, to ensure that the executive director feels that he has all of the requisite authority to continue to be able to respond effectively and efficiently to rapidly changing conditions. The second agenda item is to have a discussion about actions the Commission has taken and could potentially take to try to mitigate the economic consequences of the adult use shutdown. I'll have more to say on that when we get to that topic. Unless the executive director requests Commission clarification or extension of his delegated authority, it is my intention to have no other votes other than for adjournment taken by the Commission. Accordingly, I will not recognize any other motions. Before I turn it over to you, Mr. Executive Director, I want to offer my thanks for your leadership in these challenging times. Mr. Executive Director, if you could walk us through the first agenda item, I'd appreciate it. Thank you.
Sure, thank you, Mr. Chairman. So as you indicated, the Commission has been working remote since a number of weeks ago. It is a step we took beginning March 16th, that Monday, and we have been fully functional since then. However, we did take a step of issuing a bulletin to industry beginning on March 13th. We've issued a series of bulletins since then, covering a range of topics. First informational, and then some have had some administrative functioning or actions to them. So that first one of March 13th was really just informational, sharing information from the Department of Public Health, the CDC, as well as OSHA around precautions and steps that businesses could be taking to protect employees as well as customers and patients. We also issued another bulletin on March 18th with updates to that information, asking that our licensees take additional steps around social distancing, and also asking that they take steps to protect our employees who may be in those facilities. On March 20th, we issued a bulletin to industry as well as clinicians asking or informing them of the ability to seek a waiver for the use of telehealth for initial patient registrations. As the commission will recall, the commission's regulations allow for the use of telehealth by regulation for renewal of patient registrations. However, it did require that an inpatient or in-person visit occur for an initial registration to occur. So, however, given the governor's underlying actions relative to telehealth and advising providers in a medical context to use and leverage telehealth capabilities, we thought it prudent and appropriate to allow for patients and providers to leverage technology as we have in that initial visit. However, that telehealth waiver as written right now will expire will expire when the state of emergency does cease. We also ask that an in-person patient visit occur prior to the renewal of that patient registration, thus establishing that in-person visit during the course of a calendar year to make sure that a consultation does occur. On March 23rd is when the governor issued his essential services order, which did effectively close a lot of businesses across the Commonwealth. We issued a number of documents that day. The first was a cease and desist to a lot of adult use businesses. We also issued a bulletin advising a number of things or steps that the commission was doing. We also issued an FAQ document, which I think a lot of questions swirled. We tried to buttress a lot of the cease and desist, which has a lot of legalese to it, with FAQs and other information that tried to fill in a lot of those lines and color in a lot of those missing pieces. Furthering the guidance, which it seems like on a daily basis is being updated from both the federal government and state government as well as local government. On March 27th, we issued an administrative order authorizing the use of curbside operations for medical dispensaries, which is again meeting that guidance and really an endeavor to get patients specifically and customers outside of a physical storefront context, and really minimizing as much as possible that physical contact and interaction with store employees and patients, and really emphasizing that social distancing. So this authorizes dispensaries to conduct curbside operations, again, within the physical location of the entity itself, all requiring that the transaction occur within the licensed premises, on camera, that also leveraging the mobile or phone transaction, that everything be done. There's no cash transactions, that it be conducted in a safe, secure environment. We also require notice to be granted or given to the municipality within which the transaction will occur. We require that the entity provide us with an updated SOP as to how these operations will be conducted. And so really trying to get as much as possible these transactions to occur outside of the actual normal course of business as far as the transaction is concerned. So that was March 27th. March 31st, we issued a bulletin relative to hand sanitizer. This stems from a March 23rd order that was issued by the Commissioner of Public Health. This is actually, I think, is a really interesting and frankly a feel-good story that comes from a number of our licensees that approached the Department of Public Health, noticing that a lot of distilleries and pharmacies were able to manufacture a hand sanitizer, stepped forward and said, we think we have both the skills as well as the equipment that we could do this, but we just don't have the authority, essentially. We don't have the license type to do it. Now, distilleries are able to do it because they are licensed by the federal government through the Alcohol, Tobacco, and Trade Bureau. Pharmacies can do it through the FDA. They approached the Department of Public Health and said, well, again, we think we have the authority, we think we have the equipment and the skill set to do it. The Department of Public Health issued an order authorizing them to do it, not for commercial use, not for sale to the public, but instead for donation to Massachusetts hospitals. That order was issued again by the Department of Public Health, issued directly by the Commissioner on March 23rd. We issued a bulletin to all of industry saying, please be aware that this authorization has been granted by the Department of Public Health. The manufacturing is consistent with the World Health Organization standards. We do not believe that there is any additional requirements needed to be authorized by the Commission. What might be triggered is if there is going to be manufacturing conducted consistent or used in consultation with a pharmacist, there might be a need to consult, obviously, a pharmacist. Our preference, of course, especially in today's day and age, would be that that consultation would be by telephone or video conferencing. But if a pharmacist were to be on site, our visitor policies would authorize that. But of course, if any licensees need to run that by us, we stand ready to consult and or stand ready to work with them to facilitate that. So we wanted to make sure that all of industry was aware of that order. So in the event they wanted to produce hand sanitizer consistent with it, that they were aware of it. And just yesterday, we issued another bulletin relative to fingerprinting. Again, not like many other businesses, our fingerprinting requirements are a third-party vendor, which is IDEMIA. A lot of applicants, as they work their way through our process, once they're deemed complete, are served a notice that their application is complete. They are then asked to schedule an appointment to get their fingerprinting done. Those appointments, as they're made, some of those facilities and locations across the state have been closed based on where they sit in proximity. Some of them are in strip malls and other locations. If they are closed, those appointments might be canceled abruptly. Some of those locations are also limiting their hours based on personnel availability. As a result, some applicants have taken to submitting waiver requests to us. So we tried to put out a bulletin. We did put out a bulletin yesterday suggesting that there is a website that applicants can go to check availability for appointments. At this point, I'm not prepared to, or I'm frankly not comfortable issuing a waiver of that requirement. Instead, we'd recommend to the Commission at meetings that are coming up, we may propose it as a condition of securing a final license. This would be my recommendation to the Commission to consider. But instead of issuing a waiver of that requirement, instead present it as a condition for final licensure. But locations are available. You can still make an appointment. I'm sure those appointments are, of course, more competitive now as far as getting them because the slots are more limited. But this does raise an issue that we're going to continue using the bulletin process to advise licensees and applicants of news as we learn it. But of course, this is an evolving process. News is becoming available again on an hourly or daily basis, and we're learning alongside. I do have to really commend our staff. I think we're adapting to a home environment. We are adjusting. I mentioned the telehealth piece earlier. That was issued on March 20th. We've issued more than 30 waivers to clinicians to issue those initial certifications via telehealth. In the intervening time from March 23rd through April 1st, we've received more than 1,300 new patient registrations. In the 10 days prior, we received 500 patient registrations. So that's a significant jump in patient registration. So I think it just goes to show that there is significant interest. That said, we've processed all of those registrations as well. So as much as there was a jump, we've also met it. And I think we've met it with a capability that we've been, I won't sit here before you and say we were anticipating this. I don't think anyone could, but as you indicated at the outset, Mr. Chairman, I think we built the system not knowing what was coming. But I'm glad we spent the time and resources building for, again, the tidal wave we weren't really sure was coming. That said, I'm happy to take any questions commissioners may have. Again, I'm really proud of our staff. I'm happy we were able to provide them, first and foremost, the opportunity to work from home and the safety and security of working remotely and to be able to be home with their families. We did authorize that beginning on March 16th, and we've been home and productive ever since. Just some additional data, if I may, as well. You indicated that we've been productive, still processing applications. We were able to approve over the course of that March 16th date until now 29 applications have received their initial review. 25 applications have received a supplemental review and have been issued an additional RFI notice. 54 applications have received their supplemental review and been deemed complete, and 399 agent applications have been reviewed and approved. So we're working very hard, and that's not, frankly, that doesn't matter where we are, whether it's in the office or working from home.
Thank you very much, Sean. That truly is formidable and impressive, and again, my gratitude. If there are questions for the executive director, could you text me through the chat function? Commissioner Title, Erica, could you make her the presenter, please? Go ahead, Erica. Go ahead.
Thank you, Mr. Chairman, and thank you, Sean, for that report. Actually, before I say anything else, I just want to acknowledge for the people watching the gravity of the situation, and that we understand the gravity of the situation. And hopefully it's very clear that this is not business as usual for any of us. But I think it won't hurt to just say that we've heard you, everybody that's been reaching out. We understand the devastating nature of this for a lot of your business, that it's in addition to being literally life or death, that it's life or death for your business too, and just how uniquely unfair this feels for a lot of you, and a lot of the small businesses in particular who have overcome, every obstacle and so many odds, to now be in this situation. And of course, we are a regulatory body, so we're going to be talking about what's within our control, but I just want to make sure that we acknowledge that we understand that. So with that said, Sean, thank you so much for that report and for the actions that you've taken. And I just want to say, I really have seen in the past few weeks you and the staff demonstrating that you have created the tools to be prepared for a crisis like this. The flexibility, the ability to adapt, to not make rash decisions, but to make informed decisions quickly, to execute them smoothly. And this process that you have created of putting out bulletins, I think, is so well suited to this. So it's not just the people who are asking for the waivers and making the suggestions, which people should absolutely be doing, but everyone else who can now follow along and understand the actions that you've made. And I think you said that there's no need for a vote, but I just want to reaffirm the authority that you have to use waivers, the spirit of it. I have full confidence in the way you've used it, and I encourage you to keep using it to the fullest extent that you think is appropriate in, as you've said, this situation where the circumstances are changing by the hour. Just one minor clarification on fingerprinting. I think that's a good compromise to require it for the final license as a condition. Given that we don't know what the timing will be here, just to confirm, if there was a situation where the timing was making it so that it was very urgent and they were near final licensure, if a person was high risk and they didn't feel comfortable going in person, they could still apply for a waiver individually at that point, right? And it would be considered?
That's absolutely the case, yes. And I think that's something we have considered. Is we don't know the timing of this. I think if you had asked us in the beginning of March how long this would go, I don't think any of us would have known. And so I think we're looking ahead as far as the licensing process unfolding, the ability of, we don't want to hold up the licensing process, especially at the provisional phase. And I should also note this is not unprecedented in that early in our licensing process, before we had our interagency service agreement with the Executive Office of Public Safety and Security in full effect, our earliest licensees did have a condition on their provisional licenses And this is not our traditional background check will still be conducted on all of these licensees. And so really the fingerprint as well as the applicant's disclosures would still be in effect. So all of their disclosures would still occur on their application, their background check would still be conducted, and their fingerprint would just be an additional element that would be conducted after that. So as we get closer, if they're inching ever closer to a final inspection and their fingerprints would still not be possible, we would consider that at the time. They could still seek a waiver from that, and we would work that alongside them and ultimately bring a recommendation to the commission as to how we should proceed then. But my hope, of course, is that it would be a very small subset of a larger population at that point. But that would still be available to anybody.
Thank you.
Are there any other questions for the executive director? Okay. Thank you. I would like to just ask one last question of the executive director, and Commissioner Tile, you kind of referred to this, but I just want to be explicit. Mr. Executive Director, I want to just ask you and make sure that you feel like you have, through both statutory and commission actions, all the requisite authority required to continue to efficiently and effectively respond to changing circumstances.
I do, yes, and I appreciate the question. I think I do, as well as we have a dynamic staff that I think is creative, as well as 5 commissioners that I know are willing and able to meet in the event that I need clarification or direction on something. So I think the example of your meeting today is a perfectly vivid example of just how this agency would react in the event that I felt policy needed to be adopted or considered. If there were a situation that called for it, I know we could meet, that I could bring it to the commission and the 5 of you could address it. So there are a number of things that I think as we look ahead for the next few weeks, or potentially, depending how long this may go, that as they come up, if I feel as though it needs the commission's consideration, I would absolutely bring it to you and ask you to consider it. There are other things that I think, as we look at the application process and look at a number of just operational concerns, I think we just need to be thoughtful and perhaps creative about. But at the end of the day, it comes down to protecting our staff, making sure that we're able to work productively. I believe that we can, but that nothing is really being held up as far as our application process, our licensing process, and our compliance process. For instance, we have received a number of waivers relative to the community outreach meeting. I know, for instance, the open meeting law does allow for public bodies to meet, but the community outreach meeting is intended to be more interactive than, say, just a public meeting where the public can observe and not necessarily participate in an interactive way. And so I want to make sure, as we consider those issues, that we're able to make sure that we're able to capture the true spirit and intent of that community outreach meeting, and that applicants, as they may consider that, are able to really replicate that environment. So those are things we're working through, and we're trying to engage with applicants to make sure that we're not putting folks in a situation that public health officials would really, I think, scorn us over. But we want to be flexible and make sure that we're able to adapt to the times. So we're really trying to work as best we can with applicants and licensees in this moment. But I think, like everybody is, we're adapting to a world that didn't exist just a few months ago. So, but to answer your question more directly, Mr. Chairman, yes, I believe I have the authority that I need today to continue having those discussions and taking those actions. But if there were to be a situation where I felt I needed it, I know I have the commission ready and able to meet, as you are today, and wouldn't hesitate to ask.
Okay, thank you very much. Let me go to the second agenda item then, and that is to have a discussion about actions the commission has taken and can or could potentially take to try to mitigate the economic consequences of the adult use shutdown. I want to make a couple of comments before we get started. First, I certainly understand that many industries, companies, entrepreneurs, and employees are dealing with severe economic consequences of this unprecedented situation, not just the adult use industry. I am concerned for everybody feeling these impacts. The adult use industry is, however, unique. Because of the conflict between federal and Massachusetts law, much of the relief being offered companies and employees through the $2 trillion CARES Act will not be available to this industry. We have an obligation, I strongly believe, to do everything that we possibly can to mitigate the economic damage that's being incurred by these companies and individuals within the bounds of our regulatory authority. I want to be clear. We have and will continue to explore ways we can help, but we will not violate our mission and our fiduciary responsibilities to ensure that the industry is well regulated and promotes and enhances public health and safety. To this end, the Commission has assembled a list of potential economic mitigation actions that should be considered. The goal today is, through discussion of the Commission and the Executive Director, to sort these ideas into several groups. One, actions that have already been taken or could be implemented through our Executive Director without the need for further discussion or study. Two, actions that should be taken out of consideration for reasons including infeasibility, lack of impact, or conflict with legislative mandates and/or our fiduciary responsibilities or other reasons. And then third, actions that, while potentially impactful, require further analysis and investigation into their feasibility. For this last category, based upon the Commission's discussion today, we will appoint an individual commissioner to work with the appropriate members of staff to thoroughly and as quickly as possible determine the feasibility and to develop a plan to take specific action. As soon as these analyses are complete, we will take action, if appropriate, either through administrative action or convening another special commission meeting if necessary. I would like to ask Sean to lead us through a conversation of the ideas that have been generated to date. I welcome additional suggestions from the commissioners, and we'll work through it in the way I just described, trying to sort them into the three groups I just described. Mr. Executive Director.
Sure, thank you, Mr. Chairman. And I'll start by saying that the list to start is not, I don't want it to be construed as being complete or inclusive by any means, and really is intended to just guide your discussion. So, and it's going to range from what is, I really think some are really low-hanging fruit and administrative, and others I think are certainly a lot more complex and weighty. So, for instance, agent flexibility is one I think we can really work through with ease around flexibility between facilities without multiple registrations, as well as how to handle furloughed or laid off or terminated agents that might be eventually rehired, and not requiring them to, those agent registrations to be surrendered or be re-registered. Next would be fee waivers for the licenses, the agents of those facilities, any potential changes of those licenses, as well as metric. And I don't know, Mr. Chairman, if you want me to dive directly into these, or you want me to go through the list in its entirety?
Why don't we go through the, I think it's up to you, but my preference, I think, would be go through the list in its entirety and then come back, go through one by one. Okay.
Next would be an extension of the license dates and the agent registrations for the duration of the state of emergency, which would essentially push out the date of renewal. Next would be considering expediting other license applications that the impacted entities may have pending before the commission, the example being other locations or other license types. Next would be considering essential aspects of the medical supply chain, examples being the manufacturing and cultivation aspects. And then separately, during the state of the emergency, there have been other impacted elements of the commission's scheduled and routine pace of inspection. So aside from the shutdown, so to speak, impacts to the industry have also been on the licensing and licensing side of things as far as the inspections are concerned. So we've had to reschedule and postpone inspections. They have been rescheduled and postponed until we can conduct those inspections safely. And so upon rescheduling, we will manage that queue consistent with our licensing queue. That is to say that priority, expedited, and general applicants will be managed in that fashion, and then based on the timestamp of their inspection request. some of those logistics were going to be based on the area and state of complexity of the facility. So for instance, a large cultivation facility may take all day. If we're going to send a team to the Berkshires, we may stop and inspect a retail facility if it's a small scale on the way back. We will continue to investigate and ensure compliance throughout the state of the emergency. However, that is not to say that we don't have staff that are investigating or ensuring compliance today. We do. We'll follow up on information, feedback, and complaints that is happening today. We also have staff exploring the feasibility and thoroughness of remote work in the interim right now. That includes virtual inspections, conducting vehicle inspections, document review, interviews. So right now, the exercise we're going through is what can we do in the meantime? We've also had conversations with other states that are doing the same, going through the same exercise. Paramount in this is how do we make sure that our work does not come to a screeching halt, but also how do we make sure that the staff that we have under our employ are safe. And so it's really a balance between, again, making sure that we're able to conduct our work, but do it safely, and making sure that when things do come back to some sense of normalcy, that we don't have a backlog that needs to get worked through. But when knowing that we are rescheduling things and there will be a line, we want to make sure we're managing it in an organized fashion, but one that does have logic to it. That logic, though, I think we already have a queue, which is our licensing queue, and this should be managed in a similar fashion. So that's kind of the list that was compiled based on that exercise. But again, I don't want that to be viewed as an inclusive or complete list because it is really intended to guide the commission's discussion today.
Thank you very much, Sean. So what I would propose that we do is go back through those ideas one by one. But before we do so, let me ask if there are any other suggestions or actions that should be considered that any of the other commissioners would like to raise. Excuse me, Erica, would you make Commissioner Flanagan live, please? Commissioner Flanagan?
Thank you, Mr. Chairman, and thank you, Sean, for that inclusive list. The one thing I would like to see if this is, I believe this is going to continue well into the future, and I think that many of us understand that. Having said that, I would like to visit the issue of the positive impact plans and how some of the impact plans that we've already approved may not be prudent now, considering the fact that you can't have educational seminars, you can't have people in a room, they're probably not going to be giving donations to organizations that aren't even open. So I would like to consider the fact that we allow the positive impact plans to be altered to reflect the times that we're in for the time frame that we have the declaration of the state of emergency, and remember this once their renewals come up a year from now.
Thank you, Commissioner Flanagan. Erica, would you recognize Commissioner Doyle, please? Commissioner Doyle? Are you still on mute?
You knew that would happen.
I would have wagered a fair amount. Yes, I would have.
So thank you, Mr. Chairman. Thank you, Sean, for that thorough presentation. Really appreciate all the work that went into that. One thing that I would just like to add is work to clarify any existing ambiguities regarding the marijuana industry in particular, and what we have in terms of guidances and directives regarding the essential order. An example being the issue with the agricultural aspects of our operations and the fact that outdoor cultivators will need to get seed in the ground if they've been given authority by us, or they will miss the entire season. But we, in compliance with the governor's order, have at the moment said that there are no new plantings. So if we could sort of look at that issue and coordinate with any other applicable agencies to make sure that we are aware of what they are allowed to do and not to do, I think that would be worth exploring.
Thank you, Commissioner Doyle. Anybody else? Commissioner Erica, would you make Commissioner Title live, please? Commissioner Title?
Thank you. I want to support both of those ideas. Definitely on the disproportionate impact plans, it makes sense to allow some flexibility. Thank you, Commissioner Flanagan, for the suggestion. Could I add to that also that we ask that licensees who make those changes make the plan available on their website so that the disproportionately harmed people who are meant to benefit from it can see the plans. And also that there's just overall scrutiny to make sure that the plans are still focused on the communities that they're intended to benefit. And then along similar lines, this also seems like a time when the mandatory plans for medical treatment centers to have free or discounted medicine available to people with verified financial hardship is as important as ever when patients may have lost their jobs or are otherwise facing economic hardship. I wonder if we could ask licensees to put those programs on their website as well so that people who need them can review those programs.
Thank you, Commissioner Title. Any other, those are great, by the way. I really think those are wonderful suggestions. Any other suggestions or before we go back and go through this list and parse it? Okay, so Mr. Executive Director, if you wouldn't mind, let's go one by one. And again, you know, either we can just agree on something, we can just take act. We've either already taken action on, or we can just go ahead and take action on, take it off the table because of infeasibility or other reasons, or it requires further scrutiny, in which case we'll figure out which commissioner is going to raise their hand to work with staff to run those ideas to the ground and get them implemented if appropriate. Mr. Executive Director.
Sure. Thank you, Mr. Chairman. On the agent flexibility, I think this may end up being a case-by-case basis. The agent registration, I know, has been part of a global agent registration has been a part of a regulatory discussion for some time now, and part of this round of review. So on the how to handle furloughed, laid off, and terminated employees, on the furlough and laid off, it's something that we've already discussed with. And so I should mention the list itself was generated by discussion with some of these impacted licensees. So one of the first things we did when the cease and desist order was issued was we were in touch directly with those impacted licensees. Part of it was how are you doing? What can we do to help? And so just that personal touch, which I think was our way of saying we don't just want to hit send on an order and have that be the kind of a cold email, but instead it was that outreach to say, what else can we be doing? And so part of this list was generated from that conversation, that exercise. And so a lot of the concern of the employer was, I don't know what to tell my employees and how do I handle, for instance, at first the outreach was this would be a 2-week, until April 7th. Now that that's been extended into May, we'll follow up with those licensees as well. But we did say if it's furloughed or laid off, there's no need to surrender the registration. The registration itself is valid for a year. If they're on call, we do have registrations are also valid for volunteers that may be in the facility. So I think how to handle it is already essentially resolved. It's a matter of just we are flexible there. Between facilities without multiple registrations is something we might be able to work through on a case-by-case basis. But frankly, the waiver process might be available. But my concern there would be it might be cumbersome on an agency side as far as how to manage that. So, but I know that the regulatory process is probably the way to proceed there, frankly, long term.
Okay.
As far as fee waivers heading there next, I think, again, it might be a case by case. It probably depends on how long this process proceeds.
Do you have a recommendation, Sean? Or thoughts about how we, there's a number of things on the list that we could contemplate that you've raised. Are those decisions you feel like are within your authority to take? Is it something that you would like commission input on? In our conversations, I'm happy to work with staff, fleshing out this list and, understand the economic impacts, but I'd appreciate some thoughts from you or other commissioners about how to proceed on that entire kind of category of either deferrals or waivers.
I believe Commissioner Title made a comment as well.
Go ahead, Commissioner Title.
Thank you.
Well, I was looking at Sean's face and I forgot to check my chat box, so I apologize for not noticing that you wanted to comment.
It's a smaller comment, I think, and I'll let him go ahead with his recommendation after this. But I'm just thinking about how if you've been laid off or furloughed, it's probably very confusing to you what benefits you might be available for. I mean, probably nothing federally, probably on the state level, very confusing. I'm wondering if we could have a resource, and I would be happy to volunteer to be the person coordinating this. If we could have a resource page, if you are an agent and you've been laid off or furloughed, here are the different benefits that you might be available for. And that just may be a matter of us like contacting those different authorities to ask that question.
Mr. Executive Director, you're muted.
I was looking for the button. If Commissioner Title is willing to take that on, I think that's a perfectly appropriate task. Sure.
Okay. I've taken a note of that. Thank you, Commissioner Title. Commissioner Flanagan, could you, Erica, could you make her live? Commissioner Flanagan?
Thank you. I would think that we would want to start on the COVID-19 on the state web page, because I believe there's a resource page for people who have been laid off with regards to unemployment benefits and who is eligible for certain things, and also with regards to health care. So you may want to start there, and if you need help, Commissioner, I can be helpful with that.
Thank you.
Thank you, Commissioner Flanagan. Any other comments on the issue of agent registrations? And I think that's something, Sean, that we have administrative ability. We've already taken action. We have the administrative ability to continue to try to help out in that circumstance, aided by the suggestion of Commissioner Title to put together a resource page. So we've got that noted. Anything else on that, on the first issue of agent registrations, or should we move on?
I'm prepared to move on.
Great. Then can we talk about the second kind of generic topic of fee waivers and or deferrals? Do you have a suggestion about how we should proceed on that?
Sure. So I think it's important for, in some context, to acknowledge that in some cases the Commission has already waived or reduced fees for some of these now licensees. And so, for instance, for social equity program participants, economic empowerment applicants, the metric fee, and for context too, it's I think it's $40 per month is the metric access fee, and so the order of magnitude, it's not a lot, but it's something. It's a monthly fee. So this would not be an impact at all for those licensees. At the same token, it's a monthly fee that is due. So that's one where we, in fact, for some licensees already cover that charge. For others, the license fee is due annually and has already been paid. So the time it would be due next would be upon renewal. For agents, it has already been paid and is also due annually. And so again, the next time it would be due is upon renewal of that agent registration. And for changes, it would be due in the event that there was a change of ownership, change of location, if there was a structural change. And so we don't know if in the event that anything were to change, that's really going to be based upon the circumstances of that licensee at that time. And so it's hard to predict what the scope or the impact might be. And so I just don't know yet, again, what the potential impact or when these things may come up. So I guess you can forecast as far as when these licenses might come up as far as the renewal dates, but to say that we can waive them, I think is weathering the storm as far as surviving through May and of course April already became May for some of these licensees. I don't know how long this may go on. So I think discussions coming back to the commission with a plan for, we're going to waive the metric fee for the next month, and we're going to cover it for the next month is, I think, insufficient. And I don't know where to go next as far as licenses or changes. I think it's largely, again, going to be a case-by-case basis, and the circumstances are just unknown at this point. As far as the extension dates, I think that's going to be that would be policy that the commission would have to consider.
So
Sending out and pushing out the renewals.
thank you. I think that's, I agree with you. Forecasting is, in my opinion, kind of impossible and a waste of time right now, unfortunately, and scarily. That being said, yeah, I do think the issue of, for however long this lasts, where people are shut down for whatever period of time, considering extending their licenses for, to offset that period of time is worth consideration, in my opinion. And I would like to follow up with staff and come back to the commission, because I agree with you. I think it's a policy decision the commission would have to make. So I'm going to, unless anybody wants to raise their hand ahead of mine, I'd like to volunteer to work on that with the staff and come back to the commission on that. Okay, then let's keep going. Sean, what's the next topic?
Mr. McBride.
Commissioner McBride, I am sorry. Go ahead, Erica, could you make her live? And Commissioner McBride, please, you have the floor.
Thank you, Mr. Chair. I had a question about whether we could also look at potentially prorating license fees if we push out the renewal dates, if we could look at prorating as well, understanding that for a lot of businesses, I think they treat that fee obviously as an annual payment, but it may be something that they're spreading out over the course of the year when they're budgeting. So if we could look at that as a potential idea as well.
Thank you, Commissioner McBride. I'll just put that on the assignment I just volunteered for, but including your explicit suggestion.
Thank you.
Thank you, Commissioner McBride. Mr. Exec Director, what's next on the list?
So the next item is consider expediting the license applications that impacted entities may have pending before the commission. And so this would basically be that those entities may have other applications at other locations or other license types. And so again, the context that matters here as well, which is in the event that these licensees are already priority applicants or expedited applicants just purely based on the entity's status. This might be moot, it might not be, it depends really on the entity. And so this may have a minimal impact, this might have a sizable impact, but we have a queue already of expedited, priority, and general applicants. And I think this would also be a policy decision for the commission to make. And I think we know the universe of applicants that have been directly impacted by the essential services order. And I think we could, in pretty short order, scan the universe of applicants that are pending and know and kind of pick out who this would impact and what their status was. But to be honest, I think the impact would be minimal as far as the folks that would be pending have already kind of secured their status in our queue and likely would be already prioritized or expedited. And frankly, we, as evidenced by the fact that we've been working, I think, productively from home and working remotely, I'm not sure what added benefit it would provide necessarily, but it's something I think worth putting on the table and considering. And obviously, again, this would be a policy consideration for the commission.
Okay. Thank you, Mr. Executive Director. I have a comment on that, but Commissioner Title has asked for the floor. Erica, could you make her live? Commissioner Title? Are you muted? No, okay, you're fine.
Thank you. I don't actually know where that suggestion came from, but I want to support it because I understand and agree that probably the affected businesses would already be prioritized or expedited in some way. But nonetheless, it's worth noting that, and to be clear, this is absolutely of course not, but the way that this has worked out, the businesses that are impacted by and large are the smaller businesses, just because of the nature of adult use regulations versus medical. And so I think especially given that we don't have the authority to reopen them, we don't have the authority to give them grants, to give them loans, to help them, survive this in any way. And if we can take some small step like prioritizing them, in a way that may not already be baked in, or even if we're just doing this by spirit, because we're already doing it, either way, I support it. And thank you to whoever made that suggestion.
Thank you, Commissioner Title. One of the objectives for this meeting today is to not add to the already not overwhelming, that's a bad word, but the amazing workload that Sean and the staff are dealing with right now. And so, one of the rules I think we should operate under today is that to the extent that we are going to look into something, that a commissioner has to step up and volunteer to lead that effort. Just again, because I don't want to just continue to throw things on Sean's plate. I think it's sufficiently full for the time being. So if Commissioner Title, if you feel it's a good idea and you feel strong about it, would you volunteer to lead the effort to evaluate it and come back to the commission with a recommendation?
Of course, yes, and great point on the fact that anything we bring up today should be shouldered by a commissioner. Absolutely.
Okay, thank you. Mr. Executive Director, what's next on the list? You're muted, Sean.
Yep, we have. The next item is considering essential aspects of the medical supply chain. So I think here it's understanding that, as I indicated in the first part of the agenda, is we have noticed a surge in initial patient registrations, a pretty significant surge. While the positive side of that is that we have been able to withstand that surge as far as an operational and processing, really largely based on the investment we've made in technology and process enhancements. We do have to be mindful of supply chain. And so considering the essential aspects of that supply chain, there are manufacturing and cultivation aspects of the adult use side of things that could be fed into the medical side. And so looking at manufacturing and cultivation and allowing for some wholesale operations there could be a consideration, which really would leave the retail aspect of the essential services as the remaining elements of the shutdown. So that was something that was brought forward as an idea, which would, I think, really limit the elements of or limit the impact of the essential services order. So number 5.
Okay, thank you, Mr. Executive Director. Erica, could you recognize Commissioner Doyle, please? Commissioner Doyle? Off mute, Commissioner Doyle.
Sorry, I had actually left the microphone on, but then someone muted it for me. So, so I would like to put my hand up to work on the supply chain issues with the staff. And sorry, I'm laughing at the staff member apologizing for muting me. So,
As you're still in control of your computer?
What? No, but I would like to work on the supply chain issue. I think it is something that we may be able to do that will be effective in at least providing some economic relief to our licensees and assist the medical use of marijuana stores that are obviously facing an increased burden right now.
Thank you, Commissioner Doyle. Any other comments on this before, excuse me, would you, Erica, would you recognize Commissioner Title, please? Commissioner Title?
Thank you. So I think out of the list, I think this is the most important and the most impactful, and also to me the most logistically confusing. And so I'm very glad that Commissioner Doyle volunteered, because she's very good at this stuff. So I'm glad I feel like I need a lot more information about the supply chain, and particularly about the decisions that businesses are making. So of course, it's not our role. I don't want to interfere in any way with the decisions that businesses are making as they face this uncertainty. But I also feel like I lack the foresight right now that I need, so that as challenges come up, that we can tailor our solutions. So I would really like to have the information to be able to predict in some way, as much as we can, what's going to happen. And so I'm wondering if there's a survey or like a virtual suggestion box or something, so that we can hear from businesses about what, or if we can monitor it through metric. I'm not sure. And I can maybe come back with this being more developed, but I just feel like if we know more about the decisions that businesses are making about their supply chain, then we can make better decisions, and we can also bring that information to other decision makers with different levels of authority if we need to.
Okay, thank you, Commissioner Doyle. Any comments other than you're happy to follow up on Commissioner Title's request?
That's it.
Okay, thank you. Mr. Executive Director, let's move on to the next topic.
Sure. So that is the directly impacted as far as the cease and desist order, but I did want to at least acknowledge that outside of the scope of the cease and desist, there is still a pipeline of applicants that if, as the commission continues to meet and be open and available, and as business is still proceeding as usual, that pipeline of applicants, especially on the adult use side. And so a good example being is there was, during the course of the commission working remotely, there have been a number of commence operations that have been authorized that that would just feed right into, you're authorized to commence your operations once operations are allowed to resume, that are impacted as well. So it's really on the inspectional side of things. And so we've had to reschedule and postpone a number of inspections, really because we as a commission want to be able to do that work safely, and we want to be able to protect our staff and ensure that we're able to conduct our work in a safe environment, but also protect the employees of facilities as well. And so once we're able to reschedule those inspections, those routine inspections, we will intend to manage that process, those scheduling, in the same way that we manage our licensing queue, as I indicated earlier. So it would start with priority applicants, now priority licensees, expedited in general, and then based on the timestamp of the request, the inspectional request, when that comes in. And then I just put this caveat or this condition in there that we will also include some logistics. So again, if we're going to spend time on the Cape or we're in the Berkshires, we may, while we're out there, add some logistics to it. So again, if there's two retailers that are down the street from each other, we might do both at the same time. I think that we'll try to use our head and common sense while we're there. The other caveat I would add is that we're still investigating things, we're still following up on things, and we're still in the field, so to speak. We are, in the meantime, though, in exploring feasibility of how to do remote work in the meantime. So we have had requests of licensees or folks of, can you do a remote inspection? And we're exploring that, and we're trying to figure out our inspections, as any, I think, licensee could attest, is we're thorough. We open doors, we go through rooms, and we comb through things. So we are looking into virtual inspections. We are looking into the ability to conduct vehicle inspections and trying to look at what types of inspections are the least kind of preserve that social distance and are the least kind of interactive with licensees. So we also do a lot of document review when we conduct interviews. We know we can do those things remotely. So which aspects of inspections can we do without having to put our staff in harm's way? So I think those are things we're working through. I just wanted the commission to be aware of that. There's no real policy necessarily I'm looking for trying to explore, but I did just want the commission and the public to be aware of that, as well as the industry, that we've heard you. We are aware of your requests for us to do things remotely. We are exploring it. We appreciate your patience with us as we work through this process. I believe our very first bulletin that we put out on March 13th identified that as we do pivot to working remotely, we are also exploring our own protocols. And we appreciate one of the reasons we asked industry to take the precautions we did was to protect not just their employees, patients, and consumers, but also the staff that we're putting into those facilities. So again, we're looking at every option we can do, or every avenue we can explore, but it's really first and foremost the safety of our staff. So.
Thank you, Mr. Executive Director. Erica, could you make Commissioner McBride live, please, and then following that, Commissioner Title. Commissioner McBride.
Thank you, Mr. Chair. Sean, do we have adequate personal protective equipment for our staff at this point? What does that look like?
In a word, no. So the personal protective equipment we would use on a regular basis would include suits, Tyvek suits, the equivalent of it would look a lot like a painter's suit. So we would, especially for cultivation facilities, we would cover our feet with booties, so things we would cover to make sure we're not cross-contaminating. We would wear gloves, we would wear masks. We are not going to divert those supplies from where they belong right now. So we also buy our equipment from statewide contracts. We are not the priority on a statewide contract list right now, frankly, nor should we be. So we can probably get we have gotten the suits. We will not be getting masks. We can, at this point, I don't expect to get them for a number of weeks, if not months, but again, we can get some equipment, but we won't be getting the equipment that frankly belongs elsewhere.
Okay. Erica, Commissioner Title live, please. Commissioner Title.
So I'm pretty worried about workers and about patients. I commend you, Sean, because what a delicate and complex balance you have to maintain with that and inspecting and keeping our staff safe. So I have full confidence in what you've described. I think that the workers and the patients who need to be in the facilities anyways, while compliance is more important than ever, should think of themselves as mystery shoppers. We have mystery shoppers in our regulations, but they need to be there anyways. And I want them to feel fully protected, particularly patients who have to go there for their medicine, and might be high risk anyways, especially if they can't take advantage of delivery or curbside pickup. So I want, as Sean has already said, you can reach out to the commission with feedback and complaints. I'm going to give you my personal cell phone number right now too, because I want you to have every avenue that you possibly can. And I want businesses to understand that you have to take care of your workers and your patients right now, because I think the vast majority already understand that because it's the right thing to do. And I think the vast majority are doing that. And if you've seen my statements recently, I have said that I fully believe that this industry is responsible and compliant, and that we can use those measures to keep workers and patients safe. If I don't believe that anymore, I'm not going to say that. It's very, very important to be able to credibly say that these businesses, all of you, are protecting your patients and workers. There's nothing that's more important right now, whether it's because it's the right thing to do or because of it being a business reason, because this is just at the beginning, I think, that we're in this, and this could go on for a long time. So protect your workers, protect your patients. And my cell phone number is 857-443-0528. You can call me day or night if you're a worker or a patient and you're worried about something and you want something to be checked out. You can call me directly anytime.
Thank you, Commissioner Title. Mr. Executive Director, it sounds like on the topic we were on about inspections and how we're going to deal with some of the uncertainty and disruption, that you feel like you've got what you need. The one thing that it sounded like you were saying was complex and needed to be thought through was the issue about virtual inspections. And is that something you need or would like assistance from a commissioner on, or are you comfortable with the staff can address that and bring it back to the commission as appropriate?
Right. I think it's something we can work through. I appreciate that commissioners are available to bounce things off of and kind of I serve as that gut check, so to speak, on knowing that ultimately commissioners are going to be the ones voting on final licenses which occur after an inspection occurs. I think it's one of those things of we need to make sure that we are conducting thorough inspections. And how do you conduct a thorough inspection if we've actually never been inside a facility? And also I realized and I indicated that we are not the only state going through this. And so I know that my colleagues across the country, our colleagues across the country are going through the same exercise of figuring out how do you do this work and how do you do it remotely. So I know we've had a lot of conversations about what is the least interactive or least kind of invasive environment. So things like outdoor cultivation are a good example. Things like vehicle inspections are a good example. So what can we prioritize, or what can we kind of what are what's the low-hanging fruit, so to speak, that we can make sure that we're putting our staff in an environment that is safe for them. We can make sure that work gets done. We can front load that. And then preserve the environments that might be where there's just a lot of people. So knowing that a retail environment might have just people around there, and we want to make sure we're keeping. We want to go to those places when it's safest, and so we're working through those logistics right now. And I think it's largely a staff-led discussion, but I also realize that commissioners have input, but I don't think there's a policy there just yet.
Okay.
But I also realize that, as I indicated, I think commissioners have been, I have to thank all of you. You've been kind of that gut check in a lot of scenarios where just your availability to bounce ideas off of has been invaluable and something I rely on daily. So thank you for that.
Okay, thank you, Mr. Executive Director. That's, I think, other than the additional suggestions that were raised earlier, that we just completed your list, the list that the staff has developed. Is that correct? So I want to just go back on the things that were raised today, which I think are straightforward, but I just want to make sure from a perspective of completeness that I've got them. Commissioner Flanagan raised the issue of how positive impact plans need to be modified given the social distancing and other issues that are going on right now. Is that something, Commissioner Flanagan, that you're willing to take leadership on working with staff? Could you make Commissioner Flanagan live, please?
Yeah, absolutely. And I think that to keep it in perspective, it's really until the declaration of the state of emergency is over. So looking at a small time frame, we can work to take a look at what we were able to do, and quite frankly, what the establishments are asking that we have done, considering many of them have educational components to their plans. So yes, absolutely.
Thank you, Commissioner Flanagan. The second thing that was raised, and I'm loath to put it on Commissioner Doyle's plate, given that she's also agreed to work on the supply chain issues for the medical space, but is the issue of planting, particularly for outdoor cultivators. Is there somebody that would like to, unless there's a disagreement, this is not worth pursuing, or then I'd like somebody to raise their hand in terms of working with appropriate staff to follow up. Let me, okay, wait, hold on a second. The texts are coming in fast and furious. So I believe that Commissioner Title is next. And Erica, if you could make her live, I'd appreciate it. Commissioner Title?
Sorry, I'll pass. Can you go through the list and then come back to me?
Sure. Commissioner Erica, could you make Commissioner Flanagan live, please? Commissioner Flanagan?
I'd be happy to work on both of them with Commissioner Doyle if she wants.
So you're talking about the outdoor agricultural planting issue as well as the supply chain?
Sure.
Okay, great. Thank you. And then the last incremental suggestion that came up today was from Commissioner Title. I'm not sure that this needs a lot of further work, but the idea of requiring or asking the dispensaries to put on their website the availability of free or discounted medicine. Is that something, Mr. Executive Director, you feel like you can do?
Yeah, I actually think that might be most appropriate for an updated bulletin of some sort where it's a request, and I think we can find a way to work it into, like I said, just an updated informational bulletin to all licensees.
Thank you, Mr. Executive Director. Let me just again, just to make sure I haven't missed anything and that I've got this covered. I'm just going to go through what was agreed on today. Positive impact plans, Commissioner Flanagan will take the lead on. Agriculture and particularly outdoor cultivation and planting, Commissioner Doyle, with the assistance of Commissioner Flanagan, will take the lead on. Putting together a resource page, including tapping into existing state resources that are already available. Commissioner Title will take the lead on. The issue of extensions and proration of licenses, I will work with staff on. The opportunity to consider prioritizing other applications for people that are in the queue and are getting delayed by this process, Commissioner Title will work on, and the medical supply chain issues that we discussed. That I think I agree with everybody's comments that these are both important, potentially quite impactful, but very complicated. Commissioner Doyle will work on with the assistance of Commissioner Flanagan. Did I miss anything? Mr. Executive Director, did I miss anything?
I don't believe so.
Okay. Let me just circle back one last time. Anything else that any commissioner or executive director thinks should be on the table? Good. Thank you. I think then I would like to move towards adjournment. Excuse me. Sorry, hold on a second. I was referring to my notes. I got off my screen, so I believe that Commissioner Title would like the floor, followed by okay, Commissioner Title. So Erica, could you make Commissioner Title live, please?
Thank you. I have two questions that have been very frequently asked that I would like to ask Sean, if I may. One is very easy and one might be more complex.
Go ahead.
I will start with the easy one. A lot of people have been asking about delivery. My understanding is that we are still on track to release the delivery application in May. Is that right?
That is.
Thank you. The other question, it may not be something that you can answer right now, but I've been getting the question a lot of why can't we just deem adult use licensees to be medical? And I know that it's not that simple, but I'm having a hard time articulating exactly why clearly. Are you comfortable articulating that? And if not, could I just ask that we include that in a bulletin or an FAQ?
Mr. Executive Director.
The answer feels a bit like a bar exam question.
Well, for those of us that have never taken the bar, could you help us understand the meaning of that comment?
Well, sure. If I had 8 hours at the Boston Convention Center in a pencil and paper, I think. So, unfortunately, I think that's why the answer is not as easy as it. I think it's conceptually it should be that easy, but I don't believe that it is. It is an entirely separate license that someone would need to apply for, that has a statutory component to it, as well as the there being a host community agreement, and so there's a lot more to it than just saying we hereby deem you a medical licensee. So I guess I'm not comfortable walking through all the various steps that would need to occur, as well as, frankly, that it's not a decision that I can make on my own. So that would be an example where, Mr. Chairman and Commissioners, I don't believe I have the authority to make that decision at all, and would want, never mind the Commission's authority, but I think you would need to have a lot of consideration and probably some back and forth, and probably a pretty robust legal analysis to go into that. So could I turn it into a bulletin? I don't even know about that. I think it would be a memo or some sort of analysis and presentation to the commission to then consider. So that I think would take some time, to be honest. And it's something I think we could definitely take on, but I would have to take something off of our plate right now to wade into. So happy to think through what that process would look like, but I would have to take some staff off of some other projects to do that. But yeah, I mean, definitely happy to look into what it would take to pull that together.
Yeah, my request is, this is a complicated issue. My request is, Sean, if you would do exactly what you said, which is, give some thought to what would be required to evaluate this, but I don't think we can or should make any further decisions or comments today, other than if you could look into what would be required to evaluate this, that'd be useful. Is that okay with the rest of the commission? Okay, before I move to adjournment, are there any other comments or questions? Commissioner McBride, could you make her live, please, Erica?
I just wanted to volunteer to help Sean with that if that assistance is needed, because I think, we are trying to make sure that we're minimizing the additional burden that's being put on staff. So I'm happy to help with that if you need it.
Thank you, Commissioner McBride. Mr. Executive Director, will you accept that generous offer?
Gladly, yes, thank you.
Okay, thank you. Any other comments or questions before I move to adjournment? Okay, thank you. Our next meeting will be on Thursday, April 9th at 10 a.m. Please visit our website for details on how to join that meeting. There being no further business before the commission, I would like to ask for a motion to adjourn. Could you please text me if you'd like to make that motion? Thank you. I don't know if I can accept it as a text. Could Commissioner Flanagan, would you make that motion, please, live? Commissioner, thank you. Erica, could you make Commissioner Doyle live for a second of the motion?
Second.
Thank you. You have to do a voice vote, I'm sure. Commissioner McBride? Aye or nay?
Aye. Aye.
Commissioner Doyle?
Aye.
Commissioner Flanagan?
Aye.
Commissioner Title?
Aye.
Commissioner Hoffman? Aye. We are adjourned as of 10:17 a.m. Thank you very much to our staff for putting this together. Erica, particularly for your superb producer performance. And to everybody, thank you. Have a good weekend, and most importantly, be safe.
Thank you.